I worked out probably 5 to 6 days a week. Um, would go for walks with the dogs, do running, any kind of exercise like that. So that, very active before the injury. After the injury, nothing, not so much. Playing softball again for the first time in 20 years, and just different running style, being in the outfield, trying to chase fly balls. And had a lot of soreness like behind my knees, which was unusual. I had never had that before, so I just kept running. Figured, well, it's going to stretch out. It'll warm up, stretch out, be fine. By about the fifth game of a tournament in the weekend, almost the last inning of the game, was running in the outfield after ball, and just something just snapped or popped, and felt almost like a hyperextension of the knee, and went down immediately, and that was it. And then I had a doctor's appointment with general practitioner the following day. Wasn't getting any better. Couldn't walk. Couldn't sleep. Couldn't stand on it. Couldn't, because it would keep spasming if I left it in a certain position for too long, like the good old Charlie horses. Um, so went back and got an MRI. Finally with that, and that's when they found out that there was a tear in the hamstring tendon behind the knee, which would explain the knee pain. Um, so then started therapy again. They said, well, let's see if it'll heal by itself. So worked through that for a few weeks, and it still wasn't doing the best. He said this isn't anything he would recommend surgery for, so that's why he had recommended the therapy. But he also at the same time said try the therapy, and if you're not satisfied with that, he did describe the PRP very briefly, very quickly, and he said I can refer you to Dr. Woods and have him take a look at it and see. So he did an ultrasound and really looked at it for about 45 minutes or so, and said it was bad. He said, you've got a high grade tear. He said, you really did a number on it. And that's when he explained the PRP procedure to me. Said that was an option, we could do it today. And I was like, oh, wait, maybe not so much. What's the other option? So we looked at that in therapy. Dr. Woods was absolutely wonderful. Um, Great guy, great personality, very professional, and did absolutely put me at ease with everything, answered every question. So I would say to somebody, ask whatever questions you have. Don't worry about it sounding stupid or not, because it is new. But definitely, I would absolutely recommend it. Much more than surgery, cortisone, any of that. It's your own body. It's your own body healing itself. So that it's the best way to go.